Okay, this video on healthcare is being made entirely to blast the Canadian and British system. And I'm not going to lie, I think socialized medicine is idiotic. I don't think it works. I think it's stealing from people, and that socialized medicine is bad. Okay, so this video is to essentially to criticize the National Health Service of England and the Medicare system that exists in Canada, and to criticize specifically single payer healthcare. Okay. Now, everyone who's watching this has to know what single payer is. You know, the government taxes everyone. It goes into one giant fund, and then whenever someone in the country gets sick, they draw from that one fund and pay for all the medical problems. Okay, and it's similar to what an HMO will do. When an HMO collects people, it draws money from all of them, puts it in a fund, and when people get sick, they pull from that fund. Except in the HMO system, apparently, they just drop people left and right. In the Canadian system, no one gets dropped. Kind of funny because they do. But anyway, there are certain criticisms I want to make of both systems, and I don't know how many videos this is going to take, so I'm hoping it doesn't take any more than two. But I'm going to try to go through it and go through even what I know the Canadians and the British will say in response to this video, and try to make a response to the response that hasn't been given yet. So let me go through this and try to do it as as simply as I can. Criticism number one. The Canadian and British systems encourage people to be stupid with their healthcare. Now, what do you mean to be stupid with their healthcare? Well, here's my criticism. When the government draws taxes from everyone to put into a giant fund, people essentially think the healthcare is free. And whenever you see Canadians talking on YouTube, they're going to say this. They're going to say, why would anyone hate free healthcare? Why? We all are morons, you Americans. Or I didn't include an A in there, but that's essentially what Canadians will say when we criticize their system. They'll say, oh, you people are idiot, you're ignorant Americans. Because why would you hate free? Well, nothing is free. Nothing is free in the world, and everything has a price, and everything comes from somewhere, okay? And the government certainly doesn't have money, which means it has to take it from other people to provide this healthcare. But this specifically makes people stupid about their healthcare. And the great example I can give you was put in the video Sick in America by John Stossel, which is on YouTube. You can look it up. And in the first part of that show that he was in, he describes the satire of grocery insurance, which is essentially the same flaw with socialized medicine. It shows Stossel in some type of grocery store, and he's claiming that he has grocery insurance, and so he says, well, I have grocery insurance, and I'm paying my premium, so why don't I just fucking get everything? And he walks up to like a meat counter or something and grabs like 10 steaks and dumps them in his cart, and he says, hey, I can get whatever the fuck I want because I have grocery insurance. And this is the concept that socialized medicine creates. It makes people think that in reality nothing has a price, where everything has a price. The government tries their damnedest to fuck with the prices, but the prices are still there. And this is the biggest problem with socialized medicine, is it encourages people to be stupid, because in a system where you have to pay something that you're going to see, not just taxes, but you're going to have to go and pay for services, you're going to be smart with your healthcare. You're going to shop around. You might ask how much something costs, and every time you get sick with something that maybe isn't deadly, you're not going to go running to the doctor. I mean, if you get the flu, you get a sore throat, you're going to wait a couple of days or wait to see if you get progressively sicker before just calling the doctor. In Canada and England, that doesn't happen, okay? Which is evident by the fucking wait times for doctors. In certain provinces of Canada, it's almost impossible to find a general practitioner, and everyone knows the infamous statistic put out by the British government that states that because of wait times in the National Health Service, they're trying to reduce them to 16 weeks. Well, think about that. How long is 16 weeks? That's fucking 4 months. Okay, so it's hysterical that you have to wait 4 months for a doctor, whereas with my private insurance here, I can go see the doctor tomorrow if I wanted to, and I wouldn't have a problem. But this is But why are there these massive wait times? Because it encourages people to be stupid. When they wake up with a sore throat or they start to feel feverish, they're like, hell, I'm not paying it. It's the fund that I can draw from unlimitedly, so I'm just going to go and call the doctor, even if this isn't serious, or I'm not going to wait to see if I get better. And I'm just going to go to the doctor, and I'm going to jam up the fucking wait times for everyone else. And this is why what I like to say about any socialized system is that there are people who will come and defend it with their lives and say, it's great, I've never had the problem. Wonderful for you, but you need to think about a very important fact. Socialism helps the people that are at the front of the proverbial line. If you're the first person to call for a doctor's appointment, you're the first person who needs the surgery, you're the first person that needs the drug, I'm sure you don't have anything but good things to say about your system. You know why? Because you're the first one who's calling on the service. And so there isn't going to be a shortage yet. there's going to be a shortage for the person at the back of the line, because when you go in and you use up whatever the fuck you want, and there's 100 people behind you, by the time you get to that 100th person, well, now there aren't as many resources. Now there's the question of, this person might have to wait a few months, or this person might have to wait a year to get some type of surgery because we just don't have the resources or the time to do it now. So this is why I say socialism is good for the people at the front of the line, but not the back of the line. The people at the back of the line are fucked. But anyway, this is my first criticism of it, that it encourages people to be stupid with their health care. Okay, now the second criticism, this should be a no-brainer, but people don't care anymore, and I mean, unless you're a hardcore libertarian or anarchist or whatever, no one is going to believe this is a logical argument. But the argument is that single-payer healthcare doesn't give you a choice, and it's entirely based on involuntary action. And if you've ever read the pamphlet "The Law" by Frederick Bassat, a great piece of work by a Frenchman who is not even regarded as great in his own country, it's a pamphlet that talks about how the government can misuse its laws in the name of equality and create more inequality. And it's a pamphlet against socialism in his native France in the first half of the 19th century, and he's criticizing government policies of advocating equality, togetherness, being fraternal, which is essentially what socialism is. We have to be equal in the name of stealing from people. And Bassat called this legal plunder. The first type of legal plunder, I would argue, is corporatism. Okay, the few plunder the many. Again, not true capitalism, not a good thing, and it's never good when a company can screw people. But many people who like socialized medicine will trade legal plunder type 1 for legal plunder type 2. Everybody plunders everyone else. That's what socialism is, and that's what Bassat called it, and it's the truth, okay? And I suppose there's a twisted equality in that. If everyone is stealing from someone else, I guess there's, some equality in there, but I don't think it's the equality that many people would regard as good or fair, but socialists do. So this is my second criticism of the single payer system, is that it's based entirely on involuntary action when it should be based on voluntary action. But again, that many people will just disregard this complaint because they don't view it as logical or fair or whatever. But the biggest criticism against socialized medicine in the National Health Service and the Canadian system is the fact that it succeeds in creating a greater shortage of medical services. Okay, and this is what the basic tenets of economics are going to tell us. Okay, because when your healthcare system is free, the government has to do things to lower the costs. And in America, we see this with the Medicare system. Everyone knows that Medicare only reimburses doctors for 65% of the services they render. If I go in and I have a surgery for $100,000 and I'm a senior citizen, the government, to save money, is only going to reimburse $65,000. Well, what the fuck is the hospital going to do? They're going to have to come up with a way to make that $35,000 back that the government didn't pay for. And this is what happens in Canada, is they try to do things to save money, and they can do it a number of different ways. In Canada, the most notorious way is that they're not training enough doctors. That's a big problem up in Canada, and some people have predicted by 2015 there won't be enough general practitioners in Canada because they aren't training enough medical students. That was the way the government tried to save money in Canada. They tried to cut back on training for medical students, and it created massive problems. And I'd say in a video by the Confederal Socialist, he made a great point of pointing out that in America, there's 2.4 doctors for every 1,000 people. In Canada, there's 2.2 doctors for every 1,000 people. So despite the fact that socialism apparently works, they have less doctors in Canada, and that shortage is growing. And that's going to create a massive problem, because when you don't have enough doctors, then no one is going to have health care. And the system of simply not paying doctors back or lowering training and things like that is going to come back to bite you in the ass, because you're adding to the shortage of health services, which is the problem in healthcare in every country, but you're not doing the right thing to increase them. Instead, you're encouraging the shortage to get worse. And that's the reason why socialized medicine really doesn't work in the long term, because you're increasing a shortage as opposed to trying to fix the shortage. So that's my third main tenet or main criticism of socialized medicine, and I'll talk more about it in my next video.